Welcome to topic 3303, Examining Urban Resilience Assessment Toolkits. EPD-Net, Filling the Gap, Ecological Planning and Design Learning Network and Adaptive Smart Training Module for Disaster-Resilient and Sustainable Cities. We will see the topics of learning objectives, key insight, how cities adapt toolkits to different contexts, CRC, Bushfire and Natural Hazards Cooperative Research Center, DRI, Disaster Resilience Index, Resilience Scorecard for Cities, USAID Resilience, SPUR Scorecard, Disaster Resilience Indicators, BRIC, Coastal Resilience Index, FAO, Food Security and Livelihoods, the UN Habitat City Resilience Profiling Program, TOOL, Resil-US, a community-based disaster resilience model, TOOL, Grosvenor Resilient Cities Index, CRE, City Resilience Index, Rockefeller Foundation, URUP. Summary and takeaways in the content of the topic in order. Learning objectives of this topic are understanding the process of applying urban resilience assessment toolkits in urban planning and governance, identifying tools for data collection, scoring, and communication, learning how toolkit results are linked to action planning, budgeting, and monitoring, and answering the question, how cities use urban resilience assessment toolkits to plan for resilience in different contexts. The subjects that we will discuss under the key insight are as follows. Across all contexts, effective toolkit use depends on viewing the city as a complex adaptive system, accounting for interdependencies, combining quantitative and qualitative data, linking assessment to actionable planning, and ensuring stakeholder participation. How cities adapt toolkits to different contexts. Cities do not apply urban resilience assessment toolkits as fixed, one-size-fits-all models. Instead, they modify and contextualize them according to local risks, governance systems, socio-economic conditions, and development priorities. Cities select or adjust tools based on their dominant risks. For example, earthquake-prone cities such as San Francisco, Tokyo focus on seismic resilience models such as simulation-based or earthquake scorecards. Governance capacity strongly influences toolkit as, for example, highly institutionalized cities may use comprehensive frameworks such as the Rockefeller Foundation's City Resilience Index, or cities with developing governance systems may adopt simplified scorecards or community self-assessments. Resilience priorities vary depending on development level. For example, in high-income cities, focus may be on infrastructure robustness and investment risk management. But in lower-income or vulnerable communities, resilience may prioritize poverty reduction, food security, and basic services. Some cities use advanced modeling software. Others rely on workshops and participatory assessments. Many cities align toolkits with international agendas such as the UN Habitat City Resilience Profiling Program, the Sendai Framework for Disaster Risk Reduction, or Sustainable Development Goals, SDGs. However, cities translate these global frameworks into locally actionable strategies. How cities use urban resilience assessment toolkits. Cities use urban resilience assessment toolkits as diagnostic, planning, and decision-making instruments to better understand vulnerabilities, prioritize actions, and strengthen long-term sustainability. These tools help translate complex resilience concepts into measurable and actionable strategies. Diagnosing vulnerabilities helps cities to identify major shocks, earthquakes, floods, poverty, climate change, food insecurity, to detect systemic weaknesses in infrastructure, governance, economy, and social systems, and to understand interdependencies across sectors. For example, the Rockefeller Foundation's City Resilience Index evaluates health, economy, infrastructure, and leadership dimensions to diagnose strengths and weaknesses. Supporting strategic planning, cities use toolkit results to integrate resilience into urban master plans, to develop risk-informed development strategies, and to align with international frameworks such as the UN Habitat City Resilience Profiling Program. Assessment findings guide policy formulation and long-term planning priorities. Prioritizing investments, urban resilience toolkits allow cities to rank risks and vulnerabilities, to identify critical infrastructure gaps, to allocate budgets more effectively, to justify funding for resilience projects by providing measurable indicators. They strengthen evidence-based investment decisions. Engaging stakeholders. Many tools include workshops, community self-assessments, qualitative scorecards, participatory processes. This ensures that resilience planning includes local knowledge and improves community ownership. Enhancing cross-sector coordination. Resilience requires coordination across infrastructure, governance, economy, social services, environment. Toolkits provide a common framework and language for different departments and stakeholders to collaborate. Monitoring and evaluation. Cities use these tools to track progress over time, to compare performance with other cities, to update policies based on new risks, to measure improvements in adaptive capacity. Quantitative and qualitative indicators help establish benchmarks for continuous improvement. Bushfire and Natural Hazards Cooperative Research Center, CRC. The CRC, Bushfire and Natural Hazards Cooperative Research Center, is an Australian research organisation focused on improving disaster resilience, particularly regarding bushfires and natural hazards. The CRC contributes to resilience planning by providing research-based evidence for policy development, supporting strategic planning at national, state, and local levels, enhancing community planning and engagement, and informing macro-level disaster risk management policies. The CRC tool helps cities and councils to diagnose disaster risks, evaluate preparedness levels, strengthen cross-sector coordination, improve long-term adaptation strategies, and link assessment results to policy and planning decisions. The CRC aligns with the Australian Natural Disaster Resilience Index (ANDRI) framework, which helps to evaluate community vulnerability, adaptive capacity, disaster preparedness, and recovery potential. It uses a scorecard method, combines quantitative data, measurable indicators, and qualitative data, expert judgment, stakeholder input. DRI, Disaster Resilience Index, is a resilience assessment framework developed under the Earthquakes and Megacities Initiative, EMI. It focuses on earthquakes hazards in the Philippines and is used by local governments, regional authorities, and national agencies. The DRI relies on technical modeling tools such as software developed by the Global Earthquake Model, GEM, or the CAPRA, Comprehensive Approach to Probabilistic Risk Assessment platform. These tools help quantify seismic risk, infrastructure vulnerability, potential losses, and recovery capacity. Cities use the Disaster Resilience Index to identify weaknesses in governance and infrastructure, to measure earthquake risk exposure, to support evidence-based disaster risk reduction, DRR, to strengthen emergency preparedness systems, and to integrate resilience into development planning. Its target is city-wide governance and financial capacity, dimensions of planning and disaster preparation, disaster response itself, and post-event recovery in Sendai, Japan. It focuses on local authorities, insurance companies, private industry. The tool is aligned with the Sendai framework for disaster risk reduction. It is structured around the 10 essentials for making cities resilient, which include institutional and administrative framework, risk identification and assessment, financial capacity, urban planning and regulation, ecosystem protection, institutional capacity, societal capacity, infrastructure resilience, disaster response and recovery and rebuilding. USAID Resilience refers to the Resilience Assessment and Programming Framework developed by the United States Agency for International Development to address vulnerability, poverty, and shocks, especially in fragile and disaster-prone regions. Its target is poverty in United States of America. It focuses on government and non-governmental organizations, donors, poverty assessment. USAID applies the Market Systems Resilience Framework that focuses on strengthening livelihood systems, economic stability, food security, institutional capacity, and community adaptive capacity. Unlike hazard-specific tools, e.g., earthquake-focused models, USAID Resilience takes a socio-economic and livelihood-centered approach and emphasizes system strengthening, long-term development, and market-based resilience. Cities or regions use USAID resilience tools to identify poverty-related vulnerabilities, to strengthen economic systems, to improve disaster preparedness, to build long-term adaptive capacity, and to guide donor investment and development policy. The SPUR Scorecard is a disaster resilience assessment tool developed by the San Francisco Planning and Urban Research Association, SPUR. The SPUR scorecard was designed to evaluate how well San Francisco is prepared for a major earthquake and to guide improvements in seismic mitigation policies, infrastructure resilience, emergency response capacity and recovery planning. Scorecard-based evaluation is primarily qualitative, checklist-style assessment, and focused on policy and preparedness gaps. The Disaster Resilience Indicators (BRIC) framework is a quantitative tool, uses statistical data, produces composite resilience scores and allows comparison between regions, used to measure community-level disaster resilience. BRIC measures resilience across several domains: social resilience, economic resilience, institutional resilience, infrastructure resilience, community capital and environmental resilience. The Coastal Resilience Index (CRI) is a community self-assessment tool developed by National Oceanic and Atmospheric Administration (NOAA) to evaluate how prepared coastal communities are for coastal hazards such as hurricanes, storm surge, coastal flooding and sea level rise. The CRI evaluates resilience across several dimensions: community planning, infrastructure and mitigation measures, emergency management capacity, recovery planning, communication systems and governance and institutional coordination. The FAO Resilience Framework for Food Security and Livelihoods focuses on strengthening the ability of vulnerable populations to withstand and recover from shocks that threaten food systems and livelihoods. Its target group is rural communities, farmers and pastoralists, national governments and development agencies. FAO defines resilience as the capacity to absorb shocks, adapt to changing conditions, and transform systems when necessary. The framework integrates agricultural productivity, market access, nutrition security, institutional support and risk management systems. It uses indicator-based assessment, which is the combination of quantitative data, food availability, income levels, nutrition indicators, and qualitative analysis, institutional capacity, governance quality. Often linked with vulnerability and food insecurity measurements. It measures FAO's resilience tools assess household food security, livelihood diversification, access to markets and resources, social protection systems and early warning and risk reduction mechanisms. The UN Habitat City Resilience Profiling Program and Tool, CRPP. CRPT is a comprehensive urban resilience assessment and planning tool developed by UN Habitat to support cities in building systemic, multi-sector resilience. Its target group is municipal governments, urban planners, national authorities and development partners. CRPP adopts a systems-based and holistic approach, viewing the city as an interconnected system of physical infrastructure, social systems, economic systems, governance structures and environmental systems. It focuses on strengthening the city's capacity to absorb shocks, to adapt to change and to transform urban systems. It uses highly comprehensive and data-intensive, which combines with quantitative indicators, qualitative assessments and spatial analysis. It produces a detailed city resilience profile. Its primary tool is the City Resilience Profiling Tool, CRPT. The CRPT uses a diagnostic methodology to determine shocks and stresses facing a city and establishes prioritized actions allowing cities to capitalize on their existing data. CRPP evaluates multiple dimensions, including governance and institutional capacity, urban planning and land use, infrastructure systems, basic services, water, sanitation, energy, economic performance, social inclusion, environmental sustainability and risk management systems. ResilUS is a community-level disaster resilience model developed by researchers at the University of Kentucky. It is designed to assess and enhance local disaster resilience through a participatory and systems-based approach. Its target group is local governments, emergency managers, community organizations and researchers. It is a simulation model. ResilUS is implemented using fragility curves to model loss and recovery with respect to time. ResilUS evaluates resilience through key community systems, typically including social systems, economic systems, institutional capacity, infrastructure systems and health systems. It emphasizes how these systems interact during and after disasters. It uses the combination of quantitative indicators, qualitative evaluation, community-based and participatory, and it produces resilience scores and diagnostic outputs. Resilience assesses preparedness capacity, inter-organizational coordination, infrastructure robustness, healthcare surge capacity, recovery capability, community adaptive capacity. The Grosvenor Resilient Cities Index, RCI, is a global index to assess and compare the resilience of major cities, particularly from an investment and economic stability perspective. Its target group is investors, financial institutions, policymakers, and urban planners. It is based on environmental and social vulnerability and adaptive capacity. It uses quantitative composite index, publicly available international datasets. It produces city rankings, enables cross-country comparison. It creates to provide a robust risk management tool for long-term investments in the face of climate changes. The index evaluates cities across multiple pillars, typically including economic strength, environmental risk and climate exposure, infrastructure quality, governance and institutional effectiveness, and social stability. The City Resilience Index, CRI, is a comprehensive urban resilience assessment framework under the 100 Resilient Cities Initiative. Its target group is city governments, urban planners, policymakers, and development agencies. The CRI is built around a structured resilience framework consisting of health and well-being, economy and society, infrastructure and environment, and leadership and strategy. It uses indicator-based framework which combines with quantitative and qualitative data. It produces a structured resilience profile and not primarily designed for ranking cities. The CRI evaluates public health systems, economic diversity, infrastructure robustness, environmental sustainability, governance effectiveness, social inclusion, and disaster preparedness. As a summary and takeaways, cities use urban resilience assessment toolkits not only to measure resilience levels, but also to diagnose systemic vulnerabilities across social, economic, infrastructure, environmental, and governance systems, improve cross-sector coordination among institutions and stakeholders, prioritize investments based on risk exposure and capacity gaps, align local strategies with global frameworks such as the Sendai Framework for Disaster Risk Reduction and the Sustainable Development Goals, strengthen adaptive and transformative capacity, and promote long-term urban sustainability and resilience. The effectiveness of urban resilience assessment tools depends on the extent to which they successfully integrate multi-scale dynamics, local, regional, national, multi-sector systems, social, economic, environmental, infrastructural, and institutional, and the complex and evolving nature of urban environments into planning and governance processes. When urban resilience assessments are embedded within governance structures and linked to policy implementation, budgeting, and long-term urban strategies, they can significantly enhance adaptive capacity and sustainable development outcomes. Urban resilience assessment toolkits help cities to define resilience of what to what by clarifying social, economic, infrastructural or environmental systems which are being protected and against which shocks and stresses. To identify interdependencies across urban systems which are recognizing to interconnect the infrastructure, governance, economy, and social systems. To prioritize investments that can help to identify critical vulnerabilities and capacity gaps. To improve cross-sector coordination among public institutions, private actors, and civil society. To develop risk-informed urban planning policies that integrate the disaster risk reduction and climate adaptation into spatial and development planning. To establish measurable indicators to evaluate resilience performance. To monitor progress over time through structured assessment frameworks and periodic reviews.